My role as the Survey Operations Director involves oversight of federal and state surveys, scheduling of those surveys, communication with the various federal and state clients, oversight of the growing survey division team members, as well as oversight of the quality assurance division. Under our contract with CMS, our surveyors conduct various types of surveys. Sometimes we're asked to assist CMS regional teams with their comparative or look behind surveys. CMS also frequently requests HMS to participate in special projects or focus surveys to help further investigate any trends or patterns they may have identified in healthcare facilities across the country. Some of those focus surveys have involved dementia care, the diagnosis of schizophrenia, completion of the MDS or the minimum data set tool, or most recently, of course, due to the national COVID-19 pandemic, we have been assisting CMS and states heavily with their infection control survey workload. HMS also conducts various other provider types for CMS and state survey agencies. We conduct surveys in ambulatory surgical centers, critical access hospitals, comprehensive outpatient facilities, end-stage renal disease facilities, federally qualified health centers, home health agencies, hospice agencies, hospitals, including EMTALA, intermediate care facilities for individuals with intellectual disabilities, long-term care facilities, organ procurement organizations, outpatient physical therapy facilities, psychiatric residential treatment facilities, rural health clinics, you name it, we survey it. We also do life safety code surveys in some of these facilities. And some of these surveys involve initial surveys, recertifications, revisits, complaint surveys, or maybe even a combination of all of them. Our survey team frequently identify immediate jeopardy situations in the facilities during the course of their surveys. And these results can sometimes lead to additional substandard quality of care or extended survey issues as well. HMS seeks to employ surveyors who are trained and experienced in all of the various survey types. We not only want to meet our clients' expectations, but we do strive to exceed those expectations. We do so by employing surveyors who we consider to meet the gold standard in the survey world. They are the best of the best. CMS and the state survey agencies rely on HMS and the expertise of our gold standard surveyors to assist with their survey workload. In order for state survey agencies to receive funding from the federal government, they have some pretty stringent timeframes they need to meet when it comes to their survey workload. And so by asking and receiving the assistance of the HMS survey division team, they can better meet those timeframes so their funding isn't impacted, which can further defeat their intention to hire surveyors, meet their timeframes, and protect the population they are tasked to protect within their own states. HMS has a tremendous amount of survey experience amongst our HMS survey division team. We have surveyors or even some members of our leadership team, such as myself, who have close to 40 years of survey experience. We have several subject matter experts on our team who have worked in leadership positions, not only within their state survey agencies, but some come to us with experience from CMS regional locations or even the CMS central office in Baltimore. By bringing all of this varied experience together on one team, I feel there's really nothing that HMS cannot accomplish when it comes to surveying. HMS surveyors have conducted surveys in almost every provider type that exists. Our surveyors have conducted surveys in all 50 states, as well as most of the US territories. Some of our surveys have involved some very serious situations in which CMS has sought out our assistance. Sometimes we're needed like the same week if there's a very serious matter that needs our attention, but HMS is always willing and committed and able to provide that service to our clients. We're here when they need us. Sometimes we need to send interpreters with our surveyors in order to communicate with residents and patients and staff, and that's especially important in the facilities located in the US territories. We also have surveyors who travel to Indian Health Service locations to ensure that they're meeting the federal regulations. Sometimes our surveyors are faced with some very different cultural views within those facilities. And that's why it's extremely important for our surveyors to be well-rounded and diverse so they can meet those cultural needs that they're faced with when they visit those facilities. Sometimes CMS or even some of our state agency clients will reach out to us with last minute needs. Perhaps they have a surveyor who's become ill and needs to be replaced at the last minute. And that happened pretty frequently during the COVID-19 pandemic. Perhaps they've received an anonymous complaint of a severe matter, such as a death or an incident of abuse that needs to be investigated. Or sometimes we'll get last minute requests if a facility is experiencing a heightened amount of media attention due to an unforeseen situation. And CMS and our state survey agency clients will need one or more of our surveyors at the last minute. We have a fabulous team, a team that's very committed to the protection of the elderly and other vulnerable populations. All I have to do is send an email or a text message to some of our team members, and someone always steps up. They always raise their hand. They always offer to assist. When they know that a patient's life is at stake, they don't hesitate to offer to assist. Even during the pandemic, when most Americans were just afraid to leave their homes, our survey teams, they were jumping on airplanes and heading across the country to visit facilities with the worst of the worst COVID numbers when it came to the pandemic crisis. They just don't rest. I've been in survey operations for a lot of years, but even I have to wonder sometimes how they do it. They jump from one location to the next, week after week after week, and they really rarely complain about it. We have such a dedicated group of folks. They truly are amazing, and it warms my heart to talk about them.